Dr. Mrs. Anita Agyemang, a specialist surgeon, and we'll be having a discussion today about breast cancer. Hello, doctor. Hello. How are you doing? Thank you for coming. So we are in the month of October, it's the month of breast cancer awareness. And as women, we have so many issues that we deal with, and breast cancer is one of them. So we want to take a look at.
The first thing I will say is not getting obese.
Okay.
Yes, so you need to live a healthy lifestyle. Yes, because naturally as you age, you may not be able to do all the exercises you do. And because the hormone is also not there after menopause, the tendency to put on is there. So try as much as possible not to put on it. The other thing too is use of contraceptive pills.
Okay.
You know, it's been shown that if you use oral contraceptive pills for over 5 years, yes, your risk of breast cancer increases. Here, I don't know much about it, but outside, some women take hormone replacements after they get menopause because the symptoms of menopause is so bad for them, they can't tolerate it and all that. So that is also one of the modifiable risk factors. And then the age at which you give birth is also very important. If you give birth after 30, it's been shown that the risk of breast cancer is high. And the reason being that when you haven't gotten a full-term pregnancy, as you've not carried a baby from day one and giving birth, what happens is that the breast cells are not mature yet. It is when you have you become pregnant, you have a full-term pregnancy and you start lactating. That is when there is this thing we call terminal differentiation of ducts. So that is when the cells actually enter into a maturation phase. So when any cell that is immature in the body is prone to getting errors in their DNA and getting prone to cancer. So the age at full-term pregnancy before 30 also reduces your risk.
Okay.
Yes. And the other thing too has to do with exposure to a certain drug called diethyl sylvester, but I don't think I should bother you with that. I don't think it's a drug that is actually in active use. And yes, I have to mention, if you don't breastfeed your children too, or you have never breastfed a baby, your risk of getting breast cancer is high. It's all because of this hormone thing. Because if you don't breastfeed, the time you expose your breast to stimulation is high. Yes, so you know that we have something called lactation amenorrhea. When you are lactating, you don't menstruate. It's because the estrogen in the body is down. So when you are breastfeeding your child, it suppresses that estrogen levels, so it reduces your risk. Yes, your risk, because you are not stimulating the breast tissue. So I think those are some of the risk factors. Modifiable.
So we can actually reduce our risk developing breast cancer.
Yes, if you do something about the modifiable ones.
Yes. Okay. So doc, is there an age that, sometimes they say, oh, after 30 or after 40, then you should go for checkups? When should, as a woman, when should you go for checkups?
Okay. Well, to check breast cancer,
So I hear early detection is.
yes, breast cancer screening has been shown to reduce or prevent death that is due to breast cancer.
Okay.
Yes.
Okay.
And that is because if you detect the disease early, the likelihood of getting cured is high. But unfortunately, in Ghana here, about 75% of our breast cancers are already in the advanced stages when we see them. Yes, for example, over the past week, I've seen 2 women with breast cancer. One of them, I mean, she's had it for like 6 months. When she saw it more, she didn't do anything about it. And she just came, and it's already advanced.
Wow.
Just
6 months.
Yes.
Wow.
You know, when it comes to cancer, it's time is of the essence, I should say, because anything can happen in a minute, in a second. And the problem is when you start having the cancer spread to other parts of the body, then. So that's why we have a lot of people dying from breast cancer. It's not because the health system is not good or maybe the doctors are not good, but it's only because they can't wait. And at that time, I mean, the higher the stage of the cancer, the lower the survival rate. So there are many recommendations, but what the US preventive strategy group recommends now is you start screening after the age of 40 if you have an average risk. Yes. If you're at a high risk, then you need to consult your doctor to see how frequently you can go for screening. Yes. So after 40, maybe every 2 years. Then after 50, every year you do, depending on which facility is available for you. Usually what we use is ultrasound and mammography. Yes, so you see your doctor, he do some breast examination for you. Breast examination for you. And then after that, you have an ultrasound done, depending on your age. If you're above 50, you get a mammography in addition. Yes, so that's frequent, the frequency. So some recommend after 40. Actually, the Forest Group, according to the WHO, has shown that is the screening mammography of benefits after 50 years. Yes. So basically, I mean, in medicine, nothing is straightforward. Yes. And what we usually do is, even though we have general recommendation, we try to individualize patient treatment as much as possible. So it will largely depend on your risk, the frequency. But it's good to be checking. As a woman after 40, you should be checking. But what is not recommended is cell-breast examination. Even if you can examine your breast, but you need to have a clinician to have a look at it for you.
Thank you, Doctor, so much for this enlightenment. So are there any other issues you'd like to talk to us about?
Yes, I would like to talk about the symptoms of breast cancer. Yes. The first and foremost symptom is a swelling in the breast that is not painful. And the problem is that because it's not painful, people will usually not seek attention for it until it becomes too late. But as soon as somebody sees pain in the breast, oh, the next day she's in the hospital. But the one that is dangerous, it will not give you anything. Breast cancer will only give you pain when it's in the advanced stages. There's only a fraction of breast cancer called inflammatory breast cancer. That one, when it happens to you, you think that maybe you have, it looks like maybe some boil or some infection. That's how it looks like. So you probably report any, but most of the others is just a lump in the breast that is not painful. Yes, the other thing is also has to do with the nipple. Sometimes you may not have a swelling in the breast, but you may see that the nipple is either going inside or is changing position. Sometimes the breast either becomes smaller or bigger than the normal one. And sometimes you see that you have some skin changes. You see that the skin of the breast looks like an orange. You see how the skin of the orange looks. We call it cold orange. When you see that sign, it's not a good sign. And sometimes some of the breasts, you may not actually, some of the cancer, you may actually not see it in the breast, but all that you see is that there's some growth in your armpits, and you might even look for it, and then you will not find it, but the cancer is there. Yes. So you have to pay attention to all these things. If fact, what I tell most of my patients is that anytime you see anything abnormal in your breast and you don't understand it, just have a clinician look at it for you, because it's better to be in the know that there is nothing wrong, or what is happening to you is not of any bad consequence, than just to be feeling free and then you go to the hospital one day, like somebody was coming to cry on me yesterday that I said she has a cancer.
Wow.
Yes. So please, as soon as you see something in your breast you don't understand, or maybe you have some discharge that is not milky, maybe you're seeing blood coming from your breast, or maybe you have seen that sometimes some of the cancers, we have one called cardiac disease, it comes like a rash. So you see that the skin of the breast, especially around the nipple, you see that it will just be flaking. And you think that you have some eczema or something.
Wow.
It's not eczema, it's breast cancer. So you have to seek early care, because early care saves life. The other thing I want to talk about is breast reconstruction awareness.
Okay.
Now, what we've noticed a lot is a lot of patients refuse breast cancer treatment because they think that the breast has to be taken away. And as a woman, how can your breast be taken away and all that? I mean, losing your breast is like losing your femininity. Yes, there are actually studies that have been done by some Nigerian doctors that have found that women who have had treatment for breast cancer, they've had their breast removed. Some of them, their husbands have left.
Wow.
Yeah, so it's when you weigh the options, considering life and dying from cancer.
Yeah.
You see, it's better to have the breast removed.
Yeah.
But I mean, there's no point living life when you have no sense of satisfaction. So, because of that, there is this thing that we want to let everybody know. We have options. We can make a new breast for you.
Okay.
So if you have your breast removed because of breast cancer,
That's great news.
yes, that is not the end. You can have the breast reconstructed. We can take some part of your body.
Breast reconstruction.
Yes.
Amazing.
We can take some part of your body for you.
Okay.
Or we can use implants to make the new breast for you. If you so wish. So it's not the end. If you have your breast removed, all hope is not lost. You can get it reconstructed.
Wow. And it's available in Ghana.
Oh yes, even in Ghana.
Wow.
So it's not a problem. So I want every woman to know that if you don't remember anything, I want you to know that if you see anything abnormal in your breast, please consult a clinician. The other thing too is, if you have been diagnosed with breast cancer, it is not the end. If you have your breast removed, you can reconstruct your breast for you. And early detection saves lives.
Wow. Thank you so much, Doc. This has been a very insightful session, and we know that we've taken notes. We're going to work with them. And thank you so much, Doc. Thank you once again. Thank you so much. Hopefully, we see you in our next video.